Psychological trauma happens when something really bad overwhelms us and we can't understand, process, or move on from it. The tricky part is that we can't clearly remember it or think about how it affects us. It stays hidden inside, showing up as symptoms and pain, changing how we see reality without us realizing it. A lot of trauma happens in childhood. Kids are especially vulnerable because they don't understand themselves or the world well. They rely a lot on parents who might not always be patient or balanced. For example, a child could be traumatized if a parent becomes very depressed after childbirth or shows extreme anger or violence. Another common type of trauma is called neglect, which means that during a crucial age between 0 to 5, especially in the first 18 months, the child wasn't properly loved or comforted. The main sign of trauma is fear. Traumatized people are scared of getting close to others, being abandoned, being humiliated, getting sick, traveling, their bodies, parties, parts of their mind, and generally the world. Trauma leaves a feeling of dread, a forgotten fear that projects into the future. As the psychologist Donald Winnicott said, the catastrophe the traumatized fear will happen has already happened. To understand what might have happened to us long ago, we should ask ourselves not so much about the past, but about what we fear will happen in the future. Our fears hold the best clues to our history. It can take a long time for traumatized people to even realize that they are traumatized. Trauma often means we have no active memory of the traumatic events, so we don't see how distorted our view of reality is. Traumatized people don't think they are unusually scared. They just think everything is terrifying. They don't notice how low their self-esteem is. They just assume others will mock and dislike them. They don't realize how uncomfortable they are with intimacy. They just think they are unhappy in their relationships. Trauma changes our view of reality but prevents us from seeing how much it does. With time, luck, self-reflection, and maybe a breakdown or two, traumatized people can start to notice that their view of the world is not necessarily accurate. It's a big step towards mental well-being to start questioning our first impulses and see how much fear, suspicion, and self-hatred we bring to situations that don't deserve them. Working through trauma is usually best done by connecting our distorted brain to another, clearly one like that of a wise friend or therapist. This helps us test our view of reality against theirs. We might start to see that we are not inherently disgusting, not everyone hates us, everything is not heading for disaster, and we are not doomed to horrific punishment. And importantly, if we face setbacks, we might be able to overcome them because we are now adults, not the traumatized infant we once were. Overcoming trauma takes years, but the process begins with a small step, realizing we might be traumatized and that the world may not be as dark and fearful as we thought. First, understand and accept that you have experienced trauma. It's okay to feel this way. Learn more about trauma so you know you are not alone. Be kind to yourself and do things that makes you feel better. Talk to a therapist if you need extra yourself with supportive people. Healing takes time, so take it one step at a time and celebrate small victories. Share this message with someone who needs it. Your kindness could make a world of difference.